221. A woman in labor is progressing well. She's been diagnosed with a large fibroid in the fundus. What should the nurse observe her for after delivery? A. Thrombophlebitis. B. Postpartum depression. C. Postpartum hemorrhage. D. Loss of bladder tone during puerperium. The answer is C. Postpartum hemorrhage. 222. Which of the following assessment is contraindicated while providing interpartum nursing care for a patient with HELLP syndrome? A. Heart sounds. B. Blood studies. C. Leopold's maneuvers. D. Deep tendon reflexes. The answer is C. Leopold's maneuvers. 223. For which of the following issues should the nurse observe the movie closely during the fourth stage of labor? A. Uterine irritability. B. Signs of infection. C. Signs of bleeding. D. Unwillingness to breastfeed. The answer is C. Signs of bleeding. 224. A 32-year-old woman has just been told that she is pregnant. She states, "As much as I love my children, I had hoped we would not have any more." This statement reflective which of the following related to pregnancy? A. Anger. B. Denial. C. Guilt. D. Ambivalence. The answer is C. Guilt. 225. After nurse assessed a newborn, she reported that the baby has syndactyly. The student nurse asked the nurse in charge, "What is the syndactyly?" Which of the following is the best nursing response? A. Fistula. B. Abnormal big head. C. Extra finger or toes. D. Finger or toes wholly or partly united. The answer is D. Finger or toes wholly or partly united. 226. A newborn is diagnosed with ventricular septal defect, VSD. Which of the following information should the nurse give to the newborn's mother? A. Cyanosis will occur most of the time during sleeping. B. Breastfeeding is not recommended for your child. C. The defect might close spontaneously after 6 months. D. A blood pressure is different on the child's arm and the leg. The answer is C. The defect might close spontaneously after 6 months. 227. A couple asked the nurse which of the first investigation they should do for infertility. Which of the following should be the proper nurse answer? A. Hysterosalpingogram. B. Serum progesterone. C. Semen analysis. D. Endometrial biopsy. The answer is C. Semen analysis. 228. A nurse is assessing a 5-month-old infant who is admitted to the pediatric ward with coarctation of aorta. Which of the following is the most common assessment findings? A. Cyanosis and clubbing hands. B. Bounding pulse and hypotonicity. C. Cyanosis occur frequently during and after feeding. D. Blood pressure is different on the arm, the leg. The answer is D. Blood pressure is different on the arm, the leg. 229. A 36-year-old woman is in her 18 weeks pregnancy, came to antenatal clinic and assessed by the nurse. She has 3 previous abortions during the first trimesters prior to pregnancy. How will the nurse document the status of the mother? A. Parity. B. Nullipara. C. Multipara. D. Primipara. The answer is B. Nullipara. 230. During vaginal examination, the nurse palpated the posterior fontanelle to be at the right side and upper quadrant of the maternal pelvis. A. ROP. B. LOP. C. OR.O.A. D. LOA. The answer is C. R.O.A. 231. A 38-year-old gravida 5 para 3 post-natal mother delivered via cesarean section. On the 4th post-operative day, the midwife noted human sign was positive. Human sign is result by pain. Which of the following like site? A. Calf. B. Foot. C. Heel. D. Thigh. The answer is A. Calf. 232. Which of the following vaccines are safe to administer to pregnant women? A. Measles. B. Tetanus. C. Rubella. D. Varicella. The answer is B. Tetanus. 233. Which of the following is independent function of primary healthcare nurse? A. Complete history and nursing assessment. B. Referral for diagnostic evolution. C. Medical examination. D. Psychotherapy referral. The answer is A. Complete history and nursing assessment. 234. Which of the following statement by the nurse describes the effect of Clomid, an ovulation-inducing drug? A. Given for the first 15 days in each cycle. B. Maximum dose is 50 mg daily for a month. C. Increase the risk of birth defects. D. It increases the risk of multiple pregnancy. The answer is D. It increases the risk of multiple pregnancy. 235. A 50-year-old woman is attending the outpatient clinic for annual checkup. Which of following should be reported if inspected during breast examination? A. Everted nipples. B. Symmetrical visible. C. Dimple in the left breast. D. Right breast is slightly larger than left breast. The answer is C. Dimple in the left breast. 236. A pregnant woman is 36 weeks pregnant was admitted to antenatal ward for observation after being involved in a car accident. The refuses when the nurse tried to touch her abdomen to perform examination, saying it is painful. She also present mild vaginal bleeding. Which of the following is the most appropriate diagnosis? A. Placenta previa. B. Tubal pregnancy. C. Abruptio placenta. D. Inevitable abortion. The answer is C. Abruptio placenta. 237. Mother of 9 children, 3 of them with congenital anomalies and 1 Down syndrome. She is a primary school graduate, with low financial status. She is not using any method of family planning. According, the primary health our nurse has referred her for counseling. Which of the following is a model concerned with disability as form of social injustice due to stigma or discrimination? A. Health belief. B. Biomedical. C. Sociopolitical. D. Economic. The answer is C. Sociopolitical. 238. A primiparous mother is calling the clinic to report that her baby often regurgitates small amount of breast milk. Which of the following is appropriate nursing advice the mother? A. Elevate the head of the bed. B. Feed the baby when he is too hungry. C. Attend to the clinic with the baby. D. Put the baby in prone position after feeding. The answer is A. Elevate the head of the bed. 239. A 10-month-old infant is admitted to the surgical ward with hydrocephalus. Which of the following indicate increased intracranial pressure? A. Bulging. B. Decreased blood pressure. C. Rapid, shallow breathing. D. Increased body temperature. The answer is A. Bulging. 240. A multigravida and 37 weeks pregnant mother presents at the antenatal clinic. Her condition is stable and her baby position and heart rate are normal. Which of the following discussion is more appropriate with the mother? A. Observe her until the 40 weeks complete. B. Family planning and birth spacing. C. Arrange for cesarean section. D. Possible of induced labor. The answer is A. Observe her until the 40 weeks complete.